Rolvedon is a man-made version of a certain natural substance made by your body. Active ingredient Eflapegrastim. It is used to help your body make more white blood cells. White blood cells are important to help you fight off infections. Eflapegrastim is given to people whose ability to make white blood cells is reduced due to chemotherapy. Indications. Rolvedon is indicated to decrease the incidence of infection, as manifested by febrile neutropenia. In adult patients with non-myeloid malignancies receiving myelosuppressive anti-cancer drugs associated with clinically significant incidence of febrile neutropenia. How to use. The recommended dosage of Rolvedon is a single subcutaneous injection of 13.2 mg administered once per chemotherapy cycle. Administer approximately 24 hours after cytotoxic chemotherapy. Do not administer within the period from 14 days before to 24 hours after administration of cytotoxic chemotherapy. Contraindications. Rolvedon is contraindicated in patients with a history of serious allergic reactions to Eflapegrastim, Precautions, or Eflapegrastim products. Reactions may include anaphylaxis. Precautions. Avoid being near people who are sick or have infections. Tell a doctor at once if you develop signs of infection. Before using Eflapegrastim, tell doctor pharmacist if you are allergic to it or to Precautions or Eflapegrastim products, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Adverse reactions. Splenic rupture, acute respiratory distress syndrome, serious allergic reactions, sickle cell crisis in patients with sickle cell disorders, glomerulonephritis, leukocytosis, thrombocytopenia, capillary leak syndrome, potential for tumor growth stimulatory effects on malignant cells, myelodysplastic syndrome and acute myeloid leukemia in patients with breast and lung cancer, aortitis, nuclear imaging,